Good morning, and thank you for joining us for the Lynn Cancer Institute updates. We're trying to keep you in the know in 2024. We're so grateful to have you all with us today and to learn from our very own oncology clinical dietitian, Marie Mirande. Today, she will be educating us on what to eat and what not to eat during your cancer treatment. At the Lynn Cancer Institute, we truly believe that nutrition education is a basic tool in the prevention of illness, as well as so important in the management of our health. And just a few notes before Marie begins. Hopefully, all of you have received her bio that was sent to you via email. And we invite you to take notes during her presentation. Marie always gives us a lot of facts and information from her research. So take notes so that if you have a question, you can put it into the Q&A box or the chat box. She will not be able to hear you or see you during the presentation, and she'll have time to address any questions at the end of the presentation. So that being said, thank you for coming, and we're very proud to introduce Marie Mirande to you. Thank you, Marie.
Thank you, Jan, and welcome everybody. Yes, I'm happy to present this presentation on what to eat and not eat during cancer treatments. I think I already saw a question about whether this would be available in the future. I know it's been recorded, and my slides, a copy of my slides are always sent out to everybody who joins in on a PDF file. So you'll have the written material available to you, but let's get started. Yes, so we're gonna get started. What to eat and not eat during cancer treatments is kind of the question for today's presentation. And the quick answer is it's highly dependent on how you tolerate or how a patient tolerates treatment. For people who have no side effects or very minimal side effects, our recommendation is to kind of keep to a healthy diet as usual. We do encourage, of course, as we mentioned in past lectures, a plant-based diet to support your healthy immune system, your gut microbiome, to provide, plant-based antioxidants, to help fight cancer along with the treatments. And, you still might want to kind of have that small frequent meals kind of schedule, even on if you're not having any side effects. But you have to remember that because of the disease itself, because of the treatments, even if you're not having side effects, our body is stressed and strained. So there are slightly higher needs for calories and protein during treatment. We want to replace losses. We want to rebuild tissue. So we want to include healthy extras to our foods, to our normal diet. So nuts and seeds and avocado and honey and dark chocolate, eggs and beans and cheese, sources of protein, chicken, fish, shrimp, things like that, that will add more protein and calories to our meals just to kind of support those higher nutrition needs. That plant-based diet, of course, as we've talked about, very similar to Mediterranean diet, a high intake of fruits and vegetables, whole grains, more fish and chicken, lean red meats when we're going to eat them, beans and lentils. And kind of eating a rainbow. That's one of my favorite expressions when it comes to a healthy diet and, what we're doing throughout the day. The majority of what we're going to talk about today is how are we going to manage the treatment side effects. So if you're experiencing side effects to treatment, this is the time where we may or may not have to change our diet depending on what those side effects are. So side effects can be changes to our bowels, either constipation or diarrhea, nausea, gas and bloating is very common. Changes to our blood sugars can happen because of the steroids, anti-nausea pills that were given during treatment. Change to appetite is certainly possible for many reasons. And some of our medications, especially our GI patients who are getting chemotherapy, can get the cold sensitivities. So, those are all challenges and things to keep in mind when it comes to choosing our meals and preparing foods. Our goal, of course, is to support the increased needs while minimizing these side effects or managing those side effects with nutrition as best we can. So we're not having to take extra medication that we may not need. You still want to include those high calorie, high protein foods in some form. The form may be different when it comes to nuts or nut butters, seeds, avocado, things like that, the eggs, the beans, the cheese. Some people may not be able to tolerate the beans, but they're okay with chicken or shrimp. Some people may not be able to tolerate milk, but they're okay with cheese. So those are all just kind of situational. But the other thing I always like to remind people is we want to manage symptoms as they come up. We're not going to cause the side effects from nutrition. So, we want to eat as normally as we can until something like that comes to be a problem. So eating well while under chemotherapy or radiation therapy can help a person. It's going to help you maintain your body's nutrition stores. It's going to keep your energy and your strength up. You potentially lower your risk of infection, heal and recover more quickly, tolerate treatment-related side effects better, and keep your immune system strong while managing these side effects. So it is very important to kind of consider the food and how we're eating and what we're eating during treatment. So let's kind of go over first, what are these different components? I always kind of assume people know what I'm talking about when I say eat more protein or eat high-fat foods or things like that. But let's just go over some basics right now. So protein is what the body uses to repair tissue, to grow and keep the immune system healthy. Without enough protein, recovery is certainly much harder. So this is what's used to build muscle in the body, to rebuild tissue in the body, and along those lines. So protein-rich foods are fish and seafood. Of course, we've mentioned eggs. Lean red meat is the preference on that one, but any red meat has protein. Poultry, chicken, turkey. Nuts and seeds, of course, your beans, your lentils, your legume family, cheese, milk, and yogurt, especially Greek yogurt, but both yogurts will have a protein, Greek being a little bit higher. And then, of course, soy, tofu or silken tofu, chickpeas, of course, all those kind of things, soybeans. So your carbohydrates provide energy, fiber, B vitamins. Fiber acts as a fuel for the good bacteria in our gut, which houses our immune system's, first defenses. There's two types of fiber, so we always have to remember if we're having a lot of GI side effects, one might be better than the other. Fruit, vegetables, oats, beans, whole grains, rice, and pasta, all are good sources of complex carbohydrates. So the form of those foods, if we're having GI distress, may change, but they're also beneficial to keep in our diet. Fats supply important fat-soluble vitamins, energy. It insulates, of course, our body. Fats are energy dense, so it helps to meet those increased calorie needs. It helps us to get more calories into a smaller volume of food when we don't have such a great appetite. So nuts and nut butter. So then you're talking about, peanuts and peanut butter, almonds and almond butter, cashew seed, sunflower seed butter, all those kind of things. Seeds, chia seeds, flax seeds, pumpkin seeds, all great to work into various kind of pastas or rice dishes or salads or whatever. Olives and olive oil, of course, sesame oil, canola oil, coconut itself is great to add into, let's say, a smoothie bowl or something like that, which can be good. So, those are the components as far as we go along. So let's talk about the specific symptoms that can come up. Anorexia is a very fancy word, basically meaning you have a poor appetite. And sometimes people get a poor appetite because they feel full quickly, which is early satiety. So feeling full quickly, you take a few bites of food, and then you're all of a sudden stuffed or feeling like you're stuffed, which is a strange feeling for many people, but it can happen. It's usually not a great idea to push a person past feeling full, because we don't want to make ourselves nauseated. But typically, the recommendation is if you're eating that small meal, if you're feeling full quickly, then you have to definitely eat more often. Stomach is going to empty within an hour or so. So eating every couple of hours helps to kind of make up the difference and bridge that gap. Eating energy dense foods, we'll talk about that on the next slide, but again, that higher calorie food. Eating by the clock. Many people lose some of the signals of being hungry, or they mask if they're masked, or they feel like nausea or something like that. So it's important to kind of, like I said, eat by the clock. If you're eating breakfast at 8, have a snack at 10, have lunch at 12, and every 2 hours after that. So you want to view eating as part of your treatment. Most of us will take our pills, no problem. I have to take my pills, but it's almost optional to eat. And it's not so much optional, especially if we want to help manage a lot of these side effects to chemo. So it doesn't have to be a meal. Sometimes I tell people not to eat meals, eat a whole bunch of snacks, eat a bunch of lighter meals, lighter, smaller snacks, things like that. Certainly a lot of people use nutritional supplement drinks between meals or after a meal to kind of make up the difference for those smaller meals. And there's nutritional supplements drinks all over the place, all different kinds, shapes, sizes, all that kind of stuff. So I usually start with trying to find one that's higher in protein, 20 to 30 grams of protein. And then, you can use that as a base in food, in a smoothie, in a milkshake, or just drink it as it is. So kind of whatever works out for you. But engaging in a little bit of light physical activity when you feel your best, when you're having a good point in your day, take a little walk, do a little something when you can. Because sometimes that can increase your appetite. Sometimes it kind of just gets your circulation going. Loss of appetite. You want things that you can grab quickly. If all of a sudden you think, oh, maybe I should eat something. You don't want to wait a half an hour to prep and make all of that, especially for fatigued, which comes along with all of this. You want things that are easy to grab, easy to prep, easy to serve. So, bars and cheese and crackers and peanut butter and crackers and things that are just quick, kind of little things of yogurt, packages of cheese, things that you can grab, protein bars. So the other thing that comes up with a poor appetite is because of that feeling full quickly, if you drink a lot at a meal, you're going to fill your stomach up faster. So one strategy is to drink the majority of your liquids between meals. About half an hour to an hour after you eat, drink your cup of water, and sip on that in between. And if you need sips of water, certainly when you're eating, just to kind of get things down and moisten it, that's fine. But chugging a lot of liquid before a meal or during a meal is going to make you feel full quicker. I mean, I don't know how many times I've sat in a restaurant, they give you your drink and you've gone through the whole 16, 20-ounce cup of water or tea or something before you even get your food. And you're certainly already feeling full. So keep that in mind, kind of drink between meals. Those energy dense foods are basically, like I said, high calorie, high protein foods in a normal or smaller volume. So when you're feeling full quickly, you want to make the most bang for your buck when it comes to food. So granola that we can add on to yogurt or just use as a cereal is a great idea. Adding avocado into foods or having avocado toast is higher calorie, smaller volume. Of course, the oils and the butters, extra butters and oils into food. Nuts and trail mix if you can tolerate the raw nuts. High protein milkshakes, of course, chicken salad, egg salad, things like that, tuna salad, ice cream, cheese slices or cottage cheese, a little bit of fruit or on its own, Greek yogurt, like I said, I can get 20 grams of protein from a cup of the Greek yogurt that I pick up. Plain Greek yogurt, I add fruit or I add pineapple or something like that. And, it works out very nicely. Like I said, there's many different nutrition supplement drinks. Some of the ones that we use a lot or suggest is Orgain, Kate Farms, Owen, which is very popular these days. NU is one you can get online. Of the Ensure products, Ensure Complete is my favorite. When we can, Boost Plus or Boost Very High Calorie. Boost Very High Calorie is 530 or 20 calories per container. It's not in the stores though. You have to order that one online also. But these are tools for getting some of those extras, get rid of bridging that gap of these smaller meals that we may be eating. So it's worthwhile looking into. Any of these can be used as a base, like a milk would be, in a milkshake or in a smoothie, or to make instant pudding or, something along those lines. Pour a little bit into a morning oatmeal, make a fancy little coffee latte drink, all of these kind of things to just kind of build up calories and protein in those things that we already doing. So some ideas, 300 to 500 calorie meal ideas. If we take that smaller, definitely a 6-ounce container of yogurt and a half a cup of granola, you're going to get, between 300 and 500 calories. The Greek yogurt itself, chopped nuts or seeds or dried fruit, again, you're going to have that. Rice or pasta with a little extra olive oil and some Parmesan cheese. That can be just basic, simple. It's easy to digest for during a chemo day when you're not really feeling so well. Just simple things like that can just be soothing instead of trying to get the chicken in or the meat or something like that. A sliced apple or slices of banana with peanut butter. I love doing this. I love banana and peanut butter. I've grown up on that. So it's a great option. Taking pretzels and dipping it in peanut butter, or the apple, or of course, your bagel and cream cheese is going to be a higher calorie kind of meal. Oatmeal, make it with milk. You could add brown sugar, you could add honey. It's usually my preference is honey, a little bit of butter or peanut butter or something along those lines, some nuts, and then like raisins or berries or fruit. A grilled cheese or a quesadilla. I've talked about my extreme wellness wraps in the past, and quick and simple, I can take one of those wraps, put some low fat or regular shredded Fiesta cheese or regular shredded cheddar, and just warm it on a little pan, fold it over, make a quesadilla. You can build off of that, make a fancier one, or just something simple like that. But those extreme wellness wraps are higher in protein and made with good kind of olive oil and seeds. So you're getting good nutrition out of that, and then you're getting more protein from the cheese. So it's a nice option, something light, something bland that, may work well on a day where you're not really feeling so well. Fortifying milk. So I know we talked about the supplement drinks being used for various items, but if you don't really like the supplement drinks, they have a weird flavor or aftertaste, or they don't really settle, then just take regular milk, 2% or whole milk, and add a non-fat dry milk, powdered milk. Combine the two. This one has a suggestion, 4 cups of whole milk with 1 cup of powdered milk. And use that for an instant pudding, use that in your cereal, have a cup with some graham crackers, something like that will work well. Excuse me. Lunch meat, of course, peanut butter and jelly. So these are all great ideas. Milkshakes can be made even higher calorie by adding the peanut butter, banana, whole milk, ice cream. So that's what actually worked out very well for some people to get that 500 calories. Again, you can take that tortilla, the cheese, add ham, and some mayo. You have a wrap You could take the quesadilla idea, add some chicken, add some avocado, and have a little bit higher calorie quesadilla if that works well for you. Stuffed pita again with avocado. So if you're eating ice cream and you're good with that, melt some peanut butter on top, and soften some peanut butter and put it on top of the ice cream, or add some chopped up nuts or almonds or something like that to add a little more protein and calories. So, the things that we love, there's a saying I think going around of eat what you want and add what you need. So that's kind of the idea here, for sure. So bowel changes can certainly come up. Constipation is certainly a very common side effect to many of our chemo. So again, small frequent meals, but drinking a lot of fluid is a big factor to keep the everything in the GI tract soft and moist. Hot beverages, hot cereals, high fiber foods can stimulate the bowel movements and everything moving through. A little bit of walk, light exercise, walking usually kind of gets everything moving too. So stool softeners, yes. Laxatives, yes. You can talk to your doctor specifically about that. But we often suggest a smooth move tea. So smooth move tea are made from senna leaves, and it can be helpful just to brew a cup of tea, and that kind of helps to get people moving also. So those are all, I think the warm beverages in the morning, a lot of people get told for some reason stop their coffee, they stop their tea, and then that's what's been helping them go every morning. So keep that in mind. Even if it's just a warm beverage, sometimes it can be helpful. Other classic high fiber foods that help with the constipation: oatmeal, prunes or prune juice, bran cereal, mangoes, figs, berries, sweet potatoes, salads, of course, veggies. Adding the seeds, flax seeds or chia seeds can help, keep people moving. A little bit higher fat foods or oils in the diet can also help because it acts as a lubricant. So avocado or olives or something also might help too. So kind of keep that in mind. And when the opposite problem comes, we still kind of want that same pattern of eating small frequent meals. You want to kind of keep a food diary and kind of keep an idea of what have I been eating and when did I have problems. And remember, it's not always what you just ate that's giving you the problem. It could be what you had the day before. Preference, eating cooked vegetables versus raw, because raw is going to be more stimulatory. It's going to move things through faster. Sorbitol, not everybody remembers or thinks about the fact that a lot of these sugar-free bars or snacks or cereals or drinks contain sugar alcohols. And sugar alcohols in a higher abundance can kind of disrupt the GI tract. It can give us distress. It can increase bowel movement. So kind of keep that in mind. Avoid gas-forming foods for sure. Your broccoli, your cauliflower, your Brussels sprouts, those kind of things. Caffeine is a stimulant. So as we just mentioned, the coffee and the hot tea may help people go in the morning because of the caffeine partially and the warm beverage. So in this case, it's going to make diarrhea worse potentially along with alcohol. So avoid high-fat foods, lactose-containing foods, and like I said, the specific type of fiber, insoluble fiber. And again, this is why you're going to keep your diary, because you want to figure out, okay, do I have problems every time I have milk or ice cream? Or do I have a problem every time I have a little bit of a salad or carrots or something? Or is nothing really making a difference? Do I have a problem every time I have grapes or an orange in the morning, or something, a raw fruit versus, oh, I had applesauce instead of an apple and I felt a little better. I had bananas this morning instead of some kind of fruit in my cereal and that went better. So little things like that can be identified. So typically rice, bananas, cooked apples, oatmeal, mashed potatoes, just the inside. Lower fiber bread like white bread or honey wheat crackers are helpful to managing diarrhea. Again, you want to keep a diary, you want to figure out exactly for yourself. if you're having really bad issues, we've recommended Banatrol Plus or Metamucil as one of those soluble fibers that kind of help to manage everything and normalize again. So those gas-forming foods, like I said, bran, broccoli, cabbage, cauliflower, Brussels sprouts, beans for sure, bok choy, raw vegetables, and like I said, dairy if you're sensitive. So some people will have difficulty swallowing. Now, if you're specific to head and neck cancers, that would be more significant and more related to the swallowing muscles. Some people will develop painful swallowing, say, like what's called esophagitis, where you get like inflammation in a raw throat, so to speak. So there is the option, of course, to see a speech therapist if there's actual muscle difficulty swallowing. You would want to alter the texture of the food. You would want things that are soft and moist and easy to chew and easy to swallow. Straws, when you have difficulty swallowing, can be complicated. It can, kind of pull things and make you swallow too quickly. So keep an eye on that. Of course, thicker liquids may be easier to swallow than thin. But and if you're really truly having dysphagia, mixed textures, like a broth with solid pieces, might be a little bit difficult to manage in the mouth. So consider pureeing that all together. And then you don't have any pieces to try to work with. Blend the soup to a smooth consistency, drain the liquid out of the fruits and maybe blend it into yogurt, things like that can be helpful. So soft and moist foods for people who have dysphagia or having kind of a painful difficulty swallowing, milk and yogurt, soft cheese like a cottage cheese or ricotta can be helpful. Ground or chopped meat with gravy is better than trying to eat a dry piece of chicken. Soft tuna salad, egg salad is easier because of that moisture that the mayonnaise is going to allow. Fish is usually easier than chicken because it's thinner in flakes. Pasta with meat sauce, pasta with Alfredo sauce, a cheese sauce, something like that is a good idea. Souffles or egg bakes or quiche or things like that are kind of a good idea. Soft cooked eggs, your soft cooked cereal. Pancakes, French toast. French toast is great because you can usually soak up a whole egg with some milk in a French toast, cook it up, and then have a pure maple syrup or honey on top. And that would be nice and soft to go down. Macaroni salad, of course, cooked vegetables, mashed potatoes, pudding. Those are your soft foods. Oral candiditis, yeast infection, things like that in the mouth. Just keep the mouth, good and clean. Again, probably still needing that soft textured, soft foods. And be careful when you have issues with mouth sores or irritation to the mouth. Citrus and tomato products might sting. It might kind of make that discomfort worse. So avoid those and do more milder fruits or apple juice or things like that instead. If you do have a yeast issue in your mouth, you would want to probably be careful of simple sugars, like sodas and lemonades and things that are made with pure sugar, just so you're not fueling the yeast growth. An interesting little option to help treat it as a tablespoon of yogurt being held in the mouth may help kind of clear that up. Remember, good bacteria fight against yeast, fight against the bad. So if something is causing us problems, so those good bacteria can fight against that. So that might be something to consider. Fatigue, we kind of already mentioned. You want things that are easy to grab, snacks, pre-made items, or cook ahead, or have somebody cook ahead and make little bowls of soup or little containers of rice bowl or something like that in the refrigerator, so you can just grab it out and heat it up, so you don't have to spend a lot of time cooking. Keep things that are shelf stable that you can grab, of course. eat good meal when your appetite is best. So if you wake up and breakfast is your best meal of the day, take advantage of that. Have that be your big meal, or have lunch be your big meal. And, when we're tired and not really able to do much in the evening, we grab something simple and quick. The activity, of course, staying hydrated is a big factor. Most people are going to need at least 64 ounces of fluid, but some people may need 10 cups instead of 8. So, take that into consideration. And of course, talk to your doctor. You may need to be evaluated for anemia, or, B12 may be low, things like that. They need to address also. Um, Gas and bloating comes up a lot. So your gas forming foods, avoid cruciferous vegetables, your broccoli, cauliflower, Brussels sprouts, kale, cabbage. Drinking from that straw, it means you're swallowing more air. So that can increase gas and bloat in your stomach. Of course, carbonated beverages can do the same also. Beans and legumes can take that problem as well. Consider the lactose, intolerance issue. Certainly, you can, if you do have a lactose intolerance, which can come up, if you've had GI surgery, if you've been having a lot of diarrhea, if you've had, just because of these pills, almond milk or cashew milk or soy milk can be better tolerated. And any of those yogurts or ice creams made with those products, or you can do the lactose-free products. You can keep the lactase pills around. So if you did want to go out and enjoy yourself and have an ice cream, just take one of those pills before, and hopefully you'll tolerate it better and be more comfortable. Some people do come up with issues with their pancreas and insufficiency, things like that. We'll go into big detail on that, but typically a low-fat diet or using some kind of digestive enzyme, pancreatic enzymes can help. But as we kind of went over in one of our last classes, there are a lot of food and herbal supplements and herbs and stuff that help with digestion. So nausea, which is very common during chemotherapy, you can help relieve nausea with ginger, with cinnamon, cilantro, cardamom, nutmeg, adding it into foods or adding it into your teas. So I've been making my green tea in the morning, adding some heavy sprinkles of cinnamon, a little lemon juice, and just for stomach relief, and it's really lovely. The GI distress, the gas, the bloating, the things that we talked about. Many different spices can help with this. Allspice, or again, cinnamon, cardamom, cilantro, mint is really great, and especially also if you get those taste changes in your mouth, mint can freshen things up. Nutmeg, lemongrass, and of course, your easier to digest grains like fennel or buckwheat, fermented foods, blueberries, can all help kind of support the gut and the gut microbiome. So kind of keep these in mind. Basil is also great. Lemon, or just a little bit of lemon and lime in food sometimes can bring out a better flavor when we have those taste changes. Sea salt is a good way of adding flavor if we need that little bit. Sea salt's better with more minerals than your over-the-counter table salt. Ginger, of course, teriyaki, onion, garlic, just as seasoning to the food can hopefully brighten something that's more bland or plain. Lemon drops and sour foods also stimulate saliva production. So if you're having a dry mouth, keep that in mind. You can add drops of lemon to your water, or you can suck on a lemon hard candy, and may kind of stimulate a little bit of the saliva production and keep it kind of going. Also, papaya, glycerin, also helpful on those things. Of course, tea with honey and lemon is good for that sore throat. Little basil apparently is also helpful with a sore throat. And anything to boost the immune system, of course, as well, turmeric. So, as I mentioned, some people get cold sensitivities, especially specific to oxaliplatinum. And so oxaliplatinum is used a lot in chemotherapy combinations. And it can create that cold sensitivity for about 5 to 7 days after each dose. So you want room temperature or warm foods. I'm going to avoid touching cold foods, if possible during these days, because it may feel like you're touching glass and be a little discomforting. So certainly use gloves if you have to reach in the refrigerator or have somebody reach in, grab something out and leave on the countertop to kind of warm up a little bit. Keep things that you can grab out of the pantry, individual juice boxes, individual milk boxes that can be kept room temperature. Can be used, poured into your cup of cereal in the morning or drink without having to get into the refrigerator. Supplement drinks, of course, your Ensure, your Premier Protein, your Boost, the Orgain, and when those can all be kept on the shelf at room temperature, so you're good with those to keep around. And the little fruit cups, your little granola bars, your protein bars, your most apples, pears, bananas, things like that can be kept out on the countertop. It doesn't have to be refrigerated. Raisin bread is a great thing to keep around. You can put some peanut butter or some butter on a raisin bread, and that will give you actually 100 calories. If you put butter on there, you might even get closer to 150 or 200. Trail mix is a great thing if you can tolerate the nuts and you're not having any GI distress from there. That's a great snack to keep around. Croissants, of course, with as a sandwich or something like that would be good too. Pudding cups, and then of course you're going to drink warmer or room temperature liquids. Some people do become what's called neutropenic. Neutropenic means your immune system has become compromised. You don't have the immune support that you once did, so it increases your risk of getting a foodborne infection. So you want to be careful of that potential foodborne illness. So you can reduce your risk by avoiding your raw, unwashed fruits and vegetables, sushi. Certainly that's the raw fish type of sushis, raw or smoked fish, unpasteurized milk, and your blue vein or your soft cheeses that aren't completely brie cheese or blue cheese or things like that may be kind of questionable if you don't have a strong immune system. So kind of keep that in mind. Some deli meats, certainly can be at a risk at times. So having more cooked foods, well-cooked meats, that's why soup is so great also. It's easy to digest, and we know everything's well cooked in a soup. We kind of keep that in mind if you are experiencing those lower blood counts in the midst of chemotherapy. So I know we've gone over a lot of different side effects, and it can be overwhelming. Everybody's experience is going to be different. So, work with staff, work with your nurses or doctors and us dietitians during your journey, and let us help you kind of figure out the best way of managing all of these needs to address the issues and find any kind of changes that you need to make. So I appreciate everybody being here, and I will stop sharing so I can see if we have any questions.
You have one in the Q&A box.
Oh. Yeah. Is collagen a good thing to take during treatment? Yeah, you can take collagen. Collagen is a protein powder that probably the evidence is a little bit stronger when it comes to hair and nails, skin, as far as building collagen in the skin and anti-aging and things like that. Whey protein has been a little bit more effective in building muscle. Either one is a source of protein, so you can do either one. I'm fine with either. So just kind of keep that in mind. But some people do actually lose their hair. Their nails become affected, their skin becomes affected. So it may be just as beneficial depending on kind of what your symptoms are. So, but yes. And I usually use collagen powder. I don't, there's collagen pills, but I don't think you're going to get the amount that you need from the pills. You're going to take a ton of pills. So collagen powders. We did a whole skin presentation in the past, and we talked about marine collagen versus bovine collagen. I suggested marine collagen, although it's harder and harder to find the marine collagen. So certainly the bovine collagen with all three types is what you kind of want to look for. And any other questions?
Yeah, there's a couple in the chat box.
Yes, you're being recorded. First time I had constipation. Can I have prune smoothie even if I don't know what I am going to have this? So if I understand Iris's question here, every chemo regimen is different, and generally in our facility, if you're one of our patients, our nurse practitioners try to have a chemotherapy teaching visit to kind of go over what the expected side effects are. If you're changing treatments, you can't assume you're going to have the same problems. But if you are having constipation from chemo, then prunes are helpful. If you're not supposed to do the fiber, or if there's somehow causing a problem, prune juice, like I said, or the smooth move tea. Smoothies on their own with fruit generally is a good idea. That's usually not a problem. If for some reason you're having the opposite problem, if you're having diarrhea, then of course that might be too much. Yeah, those are good options for constipation. Next question is, I have heard people talk about miracle fruit to help return taste to foods. What can you say? Oh, yes. And thank you for asking that question, because I forgot completely to mention miracle fruit. Miracle fruit is a very interesting fruit. It is an actual fruit. It grows on trees. You don't find it in the stores because it's kind of a specialized little berry and not really sold nutrition wise or for consumption. And they don't last long, say picked off the tree and consumed. So miracle fruit is usually powdered down into tablets or powder. What miracle fruit does is it alters the taste sensation on your tongue to very sweet. So it's gonna make things taste more sweet and maybe a little less sour, or something like that. So my comment to everybody is, a lot of the foods that we eat are sweet foods, and that may be helpful to many people. If your taste changes happen to be everything tastes sweet, I wouldn't use miracle fruit. But if you have bland, everything tastes like cardboard kind of situation, I would definitely try it. We've tried it in the past. We did have the Miracle Fruit Farms that was providing little tablet samples for us for a while. They've done that, but there is a nice farm down in Miami that you can order things from or go to. You can get the berries, you can get the tablets. Like I said, having the melting tablet for your tongue is probably the best idea because it'll last for a bit. And it's a short-term kind of thing, so it's gonna be around for maybe half an hour or so, and then it's gonna go away. So it's something that you're gonna want to continually do before a meal. So if you're having a savory meal, don't use it. If you're having ice cream, or if you're having a supplement drink, or if you're having cereal or something in the morning, or then try it out. Next question. Tell us about using the sugar, please. So there's many different forms of sugar. So sugar is a way of simple sugar like table sugar is not going to give us very much nutritional value. Sugar from honey or pure maple syrup is a different compound for one thing. It's a different type of sugar altogether. But it is going to come along with vitamins and minerals and immune boosters and things like that. So I do encourage people to use honey in their cereal, their oatmeal, or over their pancake or something like that, because that's going to be nutritionally beneficial and add a little bit more calories to their meals. Same thing with maple syrup. You're going to get pure maple syrup is going to be, again, some nutritional minerals and vitamins along with, that needed. Sugar from fruit, same thing, different from your table sugar. And you're going to get a lot of vitamins and minerals for that. So again, using fruit or pureed fruit or a little bit of 100% fruit juice to flavor something is better than your table sugar. Sorry. Next question, thoughts about foods to avoid if estrogen positive. You don't have to worry about soy. Soy is a very old concern that's been disproven. The interesting thing about soy is it is similar to estrogen in composition, but not exactly. So if soy binds to estrogen receptors on a cell, it's not going to stimulate the same metabolic effect on that cell, but it is going to block the cell. So we're finding more and more so that soy can be a cancer fighting food just so much. And same thing with broccoli, flaxseed, things like that. Again, plant-based nutrients in these foods can help to block estrogen and reduce the effect of estrogen or change the form of estrogen in the body, much like some nutrients from broccoli will do, so that it doesn't promote cancer. Actually, it kind of blocks the effects and protects from the cancer. So you can eat soy if you want to eat soy, eat it. You don't have to add it into your diet if you have estrogen positive cancer, but I wouldn't take it out if it's something that's very important to you. Non-dairy creamers is probably considered one of those processed foods. Creamers themselves, you read the list of ingredients, nothing's actually real in there. So I would have cream or milk or something real and whole versus a made-up food like non-dairy creamers. So just kind of keep that in mind also. There's a lot of different options. Coconut milk you could use, regular milk, cream. So keep that in mind. Can I have pills of broccolis? Well, one, I would rather you eat whole foods. I'm a whole foods first person. So I'd rather you eat broccoli and cabbage and broccoli. But if you're not going to eat broccoli, the pills sometimes can be a concentrated. So it depends on where you're at in treatment. If you're going into chemotherapy, things like that, pills, mega dosing of vitamins, green powders, may potentially interact with certain types of chemos. So your traditional chemotherapies all will interact with high doses of antioxidants. So we generally say no pills, no mega dosing vitamin supplements. And then of course, like I said, I'd rather you work broccoli into your meal. If you don't like the texture of broccoli, puree it into a soup, or a drink or something like that. But you kind of keep that in mind that the mega dosing of vitamins is not good. The next question is sugar dangerous? People that feed the cancer cells. Very simple statement for a very complex. No, sugar is not going to feed your cancer cells. If your cancer cells were in a petri dish, they would grow on sugar, just like any other cell of your body. That being said, your cancer cells are in a very complex human body that controls and manages blood sugars. And that Petri dish has simple, very easy to absorb sugars. If you're eating fruit and vegetables and grains, in combination with that protein and that fat, then you're going to manage blood sugars. You're not going to spike your blood sugars. You're going to keep that kind of normal, and you're going to fuel your body and boost your immune system. Okay. Sugar specifically is not going to feed your cancer. What you want is the best nutrition possible to fight your cancer. So like I said, honey is a better option than table sugar. They may be equal amounts of sugar on a label, but the form of that sugar is different. What you're getting out of that sugar is different. So think best food that you can possibly put into your body and less processed. Table sugar, high fructose corn syrup, fructose. These are all processed sugars. No, they're not great for anybody's body. So stick with the whole food concept. Stick with maple syrup and honey and fruit to sweeten your meals. And then if those don't work, I usually keep like stevia or something around if you need something like that. I think that's the next question. You don't have to avoid Splenda or artificial sweeteners completely. The amount that you would have to consume to be of any kind of problem is astronomical. But my preference personally is stevia, for a sweetener. And then it depends on the amount. Just think about the amount that are you taking like 10, 12, 15 packets of Splenda, or are you taking one a day? One a day, two a day is not going to change anything. But if you're consuming a crazy amount, you might want to cut back and just kind of keep it a little bit less processed. I think that was all of the questions. Any more? I have all these windows open. Sorry.
I don't see any more. Any other questions for Marie? I think you covered everything as you always do.
Thank you.
One more. Thank you.
And I'm sorry about my talking. For some reason, it's giving me a little itch in my throat. So I apologize for that.
I think I'm feeling it too, a lot of allergy in the air. So
Yeah.
appreciate you, Marie. We appreciate your presentation and your ease in answering all the questions. And of course, all the research that you do on all of this. It truly is so valuable to all of us. And we really appreciate it. And I know this was answered in the beginning, but all of our lectures are recorded, and we're working, or I should say, Leah is working on getting them back up onto our website. But in the meantime, if you'd like a copy of this presentation, or Marie is so generous in sharing her slides, if you'd like those, just respond to Lee when she sends out the evaluations. And as always, we appreciate your response to the evaluations. It is nice for our speakers to see. And also, if you want to add anything to it, if there's information that you would like to have, we do look at all of those and appreciate any input. And so I would just like to give you a little heads up on our September. This pretty much wraps up August, which is hard to believe, and kids back to school and everything, but September is right around the corner. And on Wednesday, September 11th, we're going to have a presentation from our survivorship series. It will be presented by our pelvic health physical therapist, Ashley Carlo. And the title is Thrive, Not Only Survive, Bowel, Bladder, and Sexual Considerations Following Cancer Treatment. That will be on Wednesday, September 11th. I'm going to have to look at the time. I think it might be 11:30, but Lee will send out the information on that when we get the flyer. And Friday, September 20th at noon will be our physician panel series. And that will be on prostate cancer, everything that you need to know. That will be presented by Dr. David Taub, Dr. Hina Saeed, and Dr. Spencer Bacow. On Wednesday, September 25th, we'll be back to our nutrition series and presented by our oncology clinical dietitian, Katie Lauterbach. And that title will be Nutritional Guidelines for Blood Cancer Treatment. And as we've seen from all of our nutrition presentations, they may be focused on a particular cancer, but what I've seen is the education is and information are good for all of us. So thank you, Marie. Thank you, everyone. Have a great afternoon and enjoy the rest of August.
Thank you.
Bye-bye.
Bye-bye.